Hello and welcome. Welcome to Hurst. I'm so glad you're joining me this afternoon or this evening. My name is Robin and we are going to talk about fluid volume deficit. We're going to talk about the causes of fluid volume deficit. Now, hop in the chat box. Let me know where you're joining me from. I would love to see where you're joining me from. If you are in Zoom, hop in that chat box. Go under comments on Facebook. I would love to see where you're joining me from. Now, fluid volume deficit. Let's get started. And then you and I are going to answer some NCLEX style questions together. Fluid volume deficit is also known as hypovolemia. Anytime you get a big time deficit like hypovolemia, we call that shock. So there's an easy way to remember this. The easiest way to remember is that there's a problem with supply and demand. For some reason right here, there is not enough supply of oxygen, of your O2, getting to the tissues to meet the body's demand for that cellular metabolism. What causes fluid volume deficit? That's what we want to look at today. Well, the first one that we're going to talk about is loss of fluid from anywhere. Now, we all understand the kind of blood loss that we experience with surgery, trauma. We all understand that, don't we? Yes. Now listen, with surgery and trauma, you are losing blood volume directly from the vascular space, and we all understand that. But let me ask you a question. Y'all, what if you have a client that has an NG tube hooked to suction, and you have to go in there and you have to keep emptying that canister? Are they losing a lot of volume right there? Yes, they're losing volume right there. Could this person go into shock from that? Yes, because they're losing a lot of fluid, right? Listen, what if you're assisting your primary health care provider with a procedure like a thoracentesis or a paracentesis? Are they pulling off a lot of fluid from that client? They are. Could they go into shock during this procedure? Absolutely. That's what we're worried about. Okay, the next one I want to talk to you about is third spacing. Now, here is Hurst Review's definition. This is when fluid is in a place that does you no good. That's right. You will not find that in the Taber's Dictionary, okay? That is Hurst Review's definition. Hey, we like our fluid to be in the vascular space, right? Well, if you are third spaced, it's not in the vascular space anymore. So it's in a place that does you no good. Think about if someone is burned. Where does all their fluid go? Well, it goes out into the tissues, right? That's why they become so edematous. That's right. Now, ascites. What is ascites? Do you know what that is? That is fluid in the abdomen. That's right, the peritoneum. Hey, it's not in the stomach, is it? If it was in the stomach would blow up. It is in the peritoneum. I bet your teacher told you that when you have a client that is experiencing ascites, there is something that you need to measure every day. Do you remember what it is? Tell me. Welcome, Florida. I'm so glad to see y'all. Look at you. Do you remember what you have to measure every day? That abdominal girth. That's right, the abdominal girth. And y'all, when the abdomen gets bigger and bigger and bigger, what is it doing? It's pushing up on my diaphragm. Well, I'm going to have trouble breathing, right? Yes, don't forget that. Breathing trouble, that's a nursing thing. Okay, let's talk about diseases with polyuria. That's next. I want you to tell me one disease that you have studied, I bet you 10,000 times, where the main symptom is polyuria. Who can tell me? Who can tell me in the chat box? I'm going to give you just a minute to chat your answer right there. Can you remember? Diabetes, that's right. Good job. Yes, diabetes. Now, when you think polyuria at Hurst Review, we want you to think shock first. Polyuria, you think shock first. Listen, that's what we're worried about because polyuria can decrease the vascular volume. Think about your vascular volume. If you have a person that is in shock, they're not going to keep putting out urine like they once did, right? No, normally when people go into shock, their urine output goes down. Why? because the body's trying to hold on to what little bit of fluid they have left, right? That's right. But listen, they can go from polyuria to oliguric all the way to anuria. When they start getting oliguric and anuric, there is something you and I as nurses better be worried about. What is it? Renal failure. That's right. We need to be worried about renal failure. Y'all, the key to passing the NCLEX is to understand why. Every function in our body has a purpose. And if you understand why, you will pass the NCLEX, because understanding why improves your critical thinking skills and your clinical judgment. And then you do not have to memorize anymore. Okay, so let's practice applying this knowledge that we just reviewed with a few NCLEX style questions, okay? As we go over these questions together, here is what I want you to remember. I want you to think NCLEX-y. I want you to assume the worst and fix the problem if you can, okay? And do not be a killer nurse. Now, your first question is going to be a select all that apply. So I want you to, I'm going to go over some select all that apply rules that I want you to consider when you're trying to answer this, okay? You will see select all that apply. We want you to read the question and approach each option as a true false. Ask yourself, is that true or is that false? And then choose all of the true options as the correct answers. Hey, guess what? You could have up to 10 options, that's right. And there is no limit on how many could be correct. It could be one or it could be all of them. So my friend Thomas is going to put the question on the screen. Chat your answers, okay? And then you and I will go over the correct answers and the rationales. All right, what are you thinking here? Let's read this question together. Which clients would you, the nurse, monitor for the development of hypovolemic shock? Select all that apply. Now, this question is asking you to determine which options provided make you worry about hypovolemic shock. Since this is a select all that apply question, we're going to practice these strategies, okay? So look at option number 1, an Addisonian crisis. Y'all, if a client has Addisonian crisis, what are we worried about right here? Remember, Addison's disease, they do not have enough what? Not enough steroids, right? This means that there is not enough mineralocorticoid, and they have low sodium and water. So if a client was in a crisis, does this mean Addison's disease is better or worse? What do you think? Worse, right? So even more so, they're going to lose more sodium and water right here. So option number 1 is true. That's right. It makes me concerned about the client developing hypovolemic shock right here. All right, what do you think about option number 2, having an allergic reaction from latex? Well, if a client is having an allergic reaction to latex, I am concerned about anaphylactic shock, right? That's right, not hypovolemic shock. So option number 2, y'all, it is going to be false. Look at option number 3, post-coronary artery stent placement. Well, this client has had stent placement in the coronary artery, which feeds what? Well, it feeds the heart, right? That's right. What is the purpose of the stent? Well, to open up the artery, right? We want to open up that artery and enhance perfusion. That's what we want, enhanced perfusion. Yes, so after this procedure, I am worried about cardiogenic shock, okay, more than hypovolemic shock. So option number 3 is going to be false. Look at number 4. Type 1 diabetes with diabetic ketoacidosis, DKA. A client with type 1 diabetes is always at risk for DKA. If they develop this, what happens to their urinary output? What does it do? You know, it increases, doesn't it? Yes, it increases. Why is that? Because there is too much sugar in the vascular space, and it has to go out in volume, right? Yes, it has to go out in volume. This client develops polyuria. Polyuria causes shock. So option number 4 is true. What do you think about option number 5? Post-motor vehicle accident with multiple open fractures. Well, if someone has open fractures, what does this mean? It means that you can see the bone or it's sticking out of the skin, right? That's what an open fracture is. Of course, we worry about infection with this, but if it is open, does that mean bleeding occurs? Do you think they're having some bleeding right here? Absolutely they are. If the client has multiple open fractures, that increases the risk of bleeding even more, which makes me worry about hypovolemic shock. So number 5 is true. So your correct answers are number 1, number 4, and number 5. All right, now, what makes Hurst Review so unique? Let me just tell you a little bit about us. We have a 98% plus first try pass rate. That's right. If you do everything we ask you to do and you follow the checklist for success that we are going to provide for you, you will enter the testing center with a 98% first try pass rate. Now, isn't that great news? Y'all, we have 24/7 NCLEX experts. That's all they do is study that NCLEX. They have it up to date every time there's a change. They are updating Hurst Review, so no worries, you are going to have the most updated content. 3-step comprehensive plan. It is NGN specific strategies, y'all. We are not just about taking a whole bunch of questions. Now, we know students love questions, but we're not just about questions. It is a plan. It's a clinical judgment and an application class. You will get those clinical judgment skills and you will be able to apply the knowledge. You have a lot of knowledge, right? Absolutely. You have a lot of knowledge because you have studied a lot during nursing school. And we show you how to apply that knowledge that you do have. And guess what? There is a money-back guarantee. For some reason, if you are unsuccessful, Hurst Review has a money-back guarantee. We will take care of you. Hurst Review is not, we do not just sign you up for a review and say good luck. We stay with you until the end. All right, y'all want to do another question together? Here is question number 2, and I will be right back. All right, let's read this question together. A client at 37 weeks gestation with a diagnosis of complete placenta previa is in the 4th stage of labor. Following the initial vital signs assessment, what action will you, the nurse, take next? Hey, look there. This is an exhibit question, right? Listen, that means that there are more information to help you answer this question. Now, if you click on this tab, do you have to open it and read all that information? No, but listen, all of that information is there, and why wouldn't you click on that and get all of the information that you can about that client? Now, when you're taking your exam, guess what? You do not have to open that exhibit. You don't. You can just choose your answer and move on to the next one. But get all of the information you can about your client, okay? All right, so let's talk. When we read this question, what are you worried about? Well, let's look at the cues together. The client delivered a baby, but they have placenta previa, right? Yes. Now, what is that? This is when the placenta is covering the vaginal opening, right? That's right. Now, it can be partial or complete. The question told us it is complete, and that is important information for us to know as nurses, right? Now, these clients are usually scheduled for a C-section, about 36 to 37 weeks gestation. Now, another cue is the 4th stage of labor. This means we are within the first 2 hours of delivery, okay? So then we have to look at the exhibit. So look at that exhibit. Now, we see the pulse of 126 and regular, respirations 26, non-labored, blood pressure 90/50, okay? What are all of these cues painting a picture of? What are they painting a picture of? Are you thinking postpartum hemorrhage? That's what you should be thinking. When you look at those vital signs, that heart rate's up and that blood pressure's down, you need to be thinking about hemorrhage, okay? So, now that we know what we're worried about, what should we do next based on the options that they have provided for us? Look at option number 1. Repeat the vital signs assessment stat. Well, this says stat to make you think right now. Well, y'all, we already said the vital signs, right? So doing them again is doing what? If we go get vital signs again, we're delaying care. We already see what our vital signs are, so we need to be addressing that, right? We never delay care, so number 1 is incorrect. Look at option number 2. Administer 500 milliliter bolus of lactated Ringer's IV. Well, if a client is hemorrhaging, will replacing this fluid loss with an isotonic solution help this client? Yes, yes. And since this is an option listed, we already have an order for that because the option is there. Remember, you have an order for everything that is already listed there. So there is an order and it will help. So number 2 is correct. Look at number 3. Notify the rapid response team. Well, let's look at that. If this client is hemorrhaging, calling for extra help is a great idea. Y'all, but we're going to start those IV fluids fast, right? If I call for help first, then I'm saying the only one thing that I am going to do right now is call for help because they're asking, what are you going to do next? Well, if you choose that answer, you got to move on to the next question, right? You've chose your answer. Did you help your client? Did you fix the problem? Okay, prepare the client for a hysterectomy. Look at that. If we cannot control the bleeding, this client may need a hysterectomy. However, we are not right there yet, right? No, this is a bit too far. Plus, how is preparing her going to stop the bleeding? Remember, if you can fix the problem and help your client, that's what you have to do. So we need to get that blood pressure up and that heart rate down, and we're going to give them administer a 500 milliliter bolus of lactated Ringer's IV. Hey, option number 2 is your correct answer. The next thing I want to show you is our free events, Hurst Mini Reviews. I want you to click on this QR code or go to hurstreview.com/free-events. If you are not participating in all these free events, you are missing out. We have a lot of these and you can check out the schedule online. We do mini reviews, NCLEX challenge, questions. There's those NCLEX style questions. NCLEX 101, y'all. That is that core information that every one of you that is going to sit for the NCLEX, you need to know, okay? And we have it all laid out for you. So don't miss any of these free events. The next thing I have for you is a discount code. Hey, we all love a discount code, right? Free 2025. That gets you $40 off of InStream. That is a live streaming 3-day review that you will absolutely love. Hurst Now is a video that you would work at your own pace. You get $25 off of that. Or Hurst Now Plus. Hurst Now Plus includes Elevate. Elevate is a product that students asked for and Hurst Review created. It is your study buddy, and it will guide you through the study of Hurst. Also, Acid Base Essentials. If you struggle with acid base, this product is for you. Check out our website, HurstReview.com. We have a 4-part series on acid base, and you will love it. So check it out. It makes it easy. There is our home office phone number. We would love for you to call us. If you still have questions, call us. There is always someone here eagerly waiting to answer those questions, okay? Make sure you are following Hurst Review on all social media outlets, Instagram, Facebook, TikTok, X. My friend Ashley, she loves to give away free stuff, and also Sarah, they have a podcast. I want you to check it out. They will keep you up to date on what's going on in the Hurst world and the NCLEX world, okay? So make sure you're following Hurst Review on all social media outlets. All right, thank you for joining today. Guess what? I have a giveaway. I am going to give away a 1,500 question bank. It's called a Q Bank. If you are registered for this event, you are eligible for this prize. Now, my IT friend, he has chosen one of you randomly, so I'm going to check and see who the winner is for today. All right. The winner of the 1,500 question bank is James Stewart. Congratulations, James. Listen, we will get this product to you. No need to get in touch with us. We have all your information because you registered. Listen, y'all, invite your friends. We want everyone to participate in these free events, okay? Your friends may not know about Hurst Review. Every nursing student needs to know about Hurst Review. All right, thank you for joining. Again, James, congratulations, and you are welcome. Just check your email and look for that product to be sent to you in the next 3 to 5 business days. That's all I have for you today. I hope you will come back to see us real soon. Stay safe. Bye for now.